Hello AP students, this is Mrs. Politsky, and I have notes for Chapter 13, Evaluating Psychological Therapies. So, therapy works. When it does, it was perceived to have helped clients diminish or eliminate their psychological problems. Long-term therapy is better than short-term therapy. All forms of therapy are about equally effective in improving a client's problems. Hans Eysenck, he had a controversial proclamation. After reviewing the existing evidence, British psychologist Hans Eysenck, he shook the therapeutic world when he claimed that roughly 2/3 of all people with non-psychotic problems recover within 2 years of the onset of their problems, whether they got therapy or not. People on waiting lists got better at the same rate as those in therapy. This meant that psychotherapy is essentially worthless, no better than having no treatment at all. Eysenck's challenge had a most important result, though. It stimulated therapists to do a great deal of research on the effectiveness of their therapies. In response to Eysenck, first, therapy is more effective than no therapy. And second, Eysenck had overestimated the improvement rates in the non-therapy control groups. Newest research basically shows that therapy was effective not only in Western industrial countries, but also in a variety of cultural settings throughout the world. There are some new questions. Can we identify therapies that are best suited for specific disorders? The Smith-Glass survey in 1977 found that behavior therapies seem to have an advantage over insight therapies for the treatment of many anxiety disorders. Insight therapies can also be effective to treat certain problems such as marital discord and depression. In the treatment of schizophrenia, mental retardation, autism, psychological therapies may be deemed effective when people suffering from these afflictions learn more adaptive behaviors. Consensus and controversy on the effectiveness of therapies. The APA conducted a survey that found that the following therapies work best for certain conditions. Behavior therapy works very well for specific phobias, bedwetting, autism, and alcoholism. Cognitive behavior therapies work for chronic pain, anorexia, bulimia, agoraphobia, depression. Insight therapies work well for couple and relationship problems. Several varieties of psychotherapy can be effective. The APA report also acknowledged that there is a legitimate role for both drug and electroconvulsive therapies in the treatment of depression. Researchers found that a common element in successful therapy is the caring, hopeful relationship and a new way of looking at oneself in the world. Effectiveness of therapy depends less on the type of therapy used and more on the quality of the relationship between the therapist and the client. Some practitioners fear that they will become locked into a therapeutic straitjacket by insurance companies, which will be unwilling to pay for any treatment not on the official list or for any deviation from approved treatments, no matter what the needs of the individual patient. So, psychology in our life. Where do most people get their help? Well, most people experience mental distress do not turn to professional therapists for help, but people in their own communities, such as friends, clergy, hairdressers, bartenders, and others with whom they have a trusting relationship. A sympathetic friend may be just as effective as a trained professional therapist. Most mental problems are not crippling disorders, and most familiar problems involve chaos, confusion, choice, frustration, stress, and loss. What can you do to help someone if they ask? First, you should realize that some problems do indeed require immediate professional treatment, such as suicide or threats to harm others. Second, you should remember that most therapy methods require special training, especially those calling for cognitive behavior therapy techniques or psychodynamic interpretation. Listening. You can rarely go wrong if you listen. Sometimes listening is all the therapy that a person in distress really needs. those who frequently arrive at their own solutions. When we talk about active listeners, this is a person who gives the speaker feedback, such as the form of nodding, paraphrasing what a person has previously said, maintaining an expression that shows interest, and asking questions for clarification. In other words, being empathetic. Acceptance. This is a non-directive therapist. Way that therapists call non-judgmental attitude. It basically means accepting the person and the problems as they are, suppressing shock, disgust, and condemnation. Also, the exploration of alternatives. People under stress may see only one course of action, so you can help by identifying other potential choices and exploring the consequences of each. Thank you very much.